So oftentimes what people don't understand about shockwave is the difference between high intensity shockwave and low intensity, or what we refer to as radial shockwave. Radial shockwave is therapeutic. It is not designed to be an intense procedure. It's designed to be repetitive, where you're coming in week by week, and it works for certain cases of plantar fasciitis. There's certainly no harm in trying it, but it's much different than high intensity shockwaves, in that high intensity shockwaves create what are called cavitation bubbles, tiny little bubbles which are almost like holes in the fascia. If we create, say, 4,000 holes in the fascia, it's almost equivalent to aerating a lawn, where you're actually pushing an aeration device over the lawn, creating all these holes in the fascia, and then we fill the holes with the patient's own PRP, which is the healing part of the patient's blood, the fraction of the blood spun down that heals. It's the combination of those two procedures that provide 80% of the relief. There are many times when a patient will have accompanying Baxter's neuritis or nerve pain. And they know when they have it because they can feel the nerve on the side of the heel, the inside of the heel, actually feel like it's hot. That usually occurs after months and months of living with fasciitis. And what we do, which I think they should consider, is a cryo procedure, freezing that nerve, because it's something to do extra that you can do very easily, and it causes no harm, and it dulls a nerve that is oftentimes so inflamed that people confuse the fasciitis.
Could you talk a little bit about what PRP is?
Platelet-rich plasma is your own blood drawn down. The part of the plasma that has a high number of platelets in it is a yellow fluid. We usually get about anywhere between 3 and 5 cc's from a patient, and that injected into the fascia when it's prepared with the shockwave is what heals the fascia. Wow. So this is a treatment. It is not a therapy, and that's the difference between high intensity and low intensity shockwave, which is, again, it's many people don't realize when they go to a site or they go to a doctor. Oh, that doctor's offering me shockwave, but it's week after week after week, and I don't need to go on anesthetic. Well, that means you're not getting high intensity shockwave.
I see.
Nothing wrong with it, but it's not as definitive as what we're doing when we treat people with shockwave.